Informing, educating, empowering,
improving the way you do business in an industry that's anything but static.
You're listening to the Agent Survival Guide podcast. 2025 Medicare Part A and B premiums and deductibles. The Centers for Medicare and Medicaid Services have announced the Medicare Part A and Part B 2025 premiums, deductibles, and coinsurance amounts. We will get into what these numbers look like for the 2025 plan year and how these changes might affect your clients. Let's begin with Part B. On November 8th, 2024, CMS announced that the monthly Medicare Part B premium will be $185 for 2025. That's an increase of $10.30 from the $174.70 in 2024. The annual deductible for Medicare Part B beneficiaries also increased, up $17 from $240 in 2024 to $257 in 2025. What's behind the change? Monthly premium increases or decreases are typically affected by the annual cost of living adjustment, or COLA for short. Other factors can sometimes play a role, but as far as pricing on Medicare Part A and B, while we are seeing an increase in costs, it is fairly similar to last year's numbers. According to the CMS release, quote, the increase in the 2025 Part B standard premium and deductible is mainly due to projected price changes and assumed utilization increases that are consistent with historical experience, end quote. Like last year, the Social Security Administration made their COLA announcement prior to CMS unveiling 2025 Medicare costs. This year's COLA came in at an increase of 2.5% in comparison to last year's 3.2% increase. In dollar amounts, the aforementioned 2.5% COLA means that clients can expect to see an increase of about $50 per check in 2025. Last thing we want to mention on Part B. In 2023, the Part B ID benefit was created by the Consolidated Appropriations Act. That was a piece of legislation allowing individuals on immunosuppressants to enroll in a special type of Part B coverage. Beneficiaries on immunosuppressants who are 36 months post-kidney transplant can still have their immunosuppressive drugs covered by paying a premium. In 2024, that premium was $103. It will increase to $110.40 for coverage year 2025. Next up, let's talk about Part A. Medicare Part A is premium-free for more than 99% of beneficiaries. Less than 1% of Medicare beneficiaries must pay the Part A premium because they do not have at least 40 quarters of Medicare-covered employment. Those who have paid Medicare taxes for less than 30 quarters will pay a Part A premium of $518 per month in 2025, up $13 from $505 per month in 2024. Beneficiaries who have paid Medicare taxes for 30 to 39 quarters will pay a Part A premium of $285 per month in 2024, an increase of $7 per month compared to the amount in 2024, which was $278 per month. The Medicare Part A inpatient hospital deductible that beneficiaries pay when admitted to the hospital for 2025 came in at $1,676, an increase of $44 from the $1,632 deductible in 2024. Part A coinsurance amounts will also increase in 2025. The daily coinsurance for days 61 through 90 will be $419 per day, and the daily coinsurance for lifetime reserve days will be twice that amount, running $838 per day for 2025. Skilled nursing facility coinsurance will also increase to $209.50 per day for 2025 claims. If you have clients who are considered held harmless, they will pay less than the standard Part B premium. The hold harmless provision states that certain beneficiaries' Part B premium increases cannot exceed the increase in their Social Security benefits. Clients who have higher incomes will be facing another round of high income-related surcharges for their Part B premiums. Over 65 million Medicare beneficiaries are enrolled in Medicare Part A, Part B, or both programs. These numbers are important to know so you can answer your clients' questions about cost of coverage and help them assess or reassess their coverage if needed. To see a breakdown of how your clients' annual incomes will affect their Medicare Part B monthly premiums for 2025, visit our episode notes for the link to the text version of this episode on our blog, as well as the official fact sheet from CMS. In the text version of this episode, we include a visual comparison between the Part A deductible and coinsurance amounts for 2024 versus 2025. And we also highlight the income brackets for the 2025 income-adjusted Medicare Part B monthly premiums. I recommend checking that resource out and bookmarking it because those tables are helpful to have at the ready when you need a quick reference. Always a great idea to visit our episode notes for links to resources we mention in the episode, as well as other relevant podcast episodes and blog posts. We aim to keep you as up-to-date as possible with information like this, especially when it directly impacts the ability of your clients to afford quality Medicare coverage. By staying current, you can serve as a well-informed, reliable, and trusted guide for your clients throughout the insurance sales process. And if you have questions about any of the stops along the way in that process, please reach out. We are happy to help. You will find links to do that in the episode notes, along with all the places you can follow along with our show. And we hope you'll take action on that as you're perusing the notes. Keep listening, and we will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.